Have you ever had that sudden, desperate feeling that you have to go, like right now? Or maybe you've wondered why you're suddenly making so many trips to the bathroom? Well, you are definitely not alone. Today, we're going to demystify our urinary health. We'll break down the most common issues in a way that's super simple and totally jargon-free. Okay, before we dive in, a really quick but super important note. This is all for your information. It is not a substitute for real medical advice. Symptoms can be tricky, so it's always best to chat with a doctor to get a proper diagnosis, especially if something feels urgent. All right, so here's our game plan. First, we're going to take a quick tour of your body's plumbing. Then, we'll turn into detectives and learn how to read the signs your body is sending. After that, we'll meet the usual suspects behind these problems, see how things change over a lifetime, and then wrap it all up with a solid action plan. Let's get to it. So let's kick things off with Section 1, your body's plumbing. Because honestly, once you get how this amazing system is supposed to work, spotting when things go wrong becomes so much easier. Think of your urinary system as this amazing, high-tech water treatment plant. Your kidneys, they're the master filters working 24/7 to clean waste from your blood and make urine. From the kidneys, the urine travels down two little tubes, those are the ureters, and into the bladder, which is basically a stretchy storage tank. When it's time to go, the urine leaves through one last tube, the urethra. It's a really elegant and super efficient process. Okay, plumbing basics are down. Now let's move on to Section 2, reading the signs. You know, our bodies are constantly talking to us, and urinary symptoms, they're some of the loudest, clearest messages we can get. It's time to learn the language. Let's start with a big one. That unmistakable, really uncomfortable burning or stinging feeling when you pee. It's one of those classic symptoms that makes you immediately sit up and go, whoa, what was that? Now, I know our minds often jump straight to a UTI, and for good reason. It's a top contender, but burning can have a bunch of different causes. It could totally be an infection, but it could also be something as simple as irritation from a new soap, or maybe you're just not drinking enough water. That's why it's so important not to just self-diagnose based on this one symptom alone. All right, what about this scenario? You just went to the bathroom, but you already feel that sudden, overwhelming urge to go again. Or maybe you've just noticed you're heading to the restroom way more often than usual. This little duo, urgency and frequency, is another huge clue. And just like with burning, the list of potential culprits here is pretty long. Yeah, it could be a UTI. But it might also be an overactive bladder, or even just the effect of that extra cup of coffee. It can also be a sign of something bigger, like diabetes, or for men, an enlarging prostate. Context really is everything. Now let's flip the script. Instead of that sudden urge to go, what if the problem is trouble while you're going? We're talking about a weak stream, maybe having to push or strain, or that super frustrating feeling that you haven't quite emptied the tank. These are what doctors call obstructive symptoms, which basically just means something is getting in the way. The most common cause in older men is an enlarged prostate, or BPH, which literally squeezes the urethra. But a blockage could also be from the urethra itself narrowing, or even something called a neurogenic bladder, which is just a fancy way of saying there's a communication breakdown between the nerves and the bladder. Okay, so we've decoded the signs. Now for Section 3, the common culprits. This is where we put some names to the faces and connect those symptom patterns to the conditions that are most often to blame. First up, the notorious UTI. To put it simply, it's an invasion. Bacteria get into your urinary system where they really don't belong, and they start to multiply. It's way more common in women, and that's just a matter of basic anatomy. A shorter urethra gives bacteria an easier path to the bladder. So here's the classic symptom checklist for a UTI. The burning, the constant need to go, and that feeling of pressure down in your lower belly. But please pay close attention to that note. If you have those symptoms, plus a fever and pain in your back or side, that could be a sign the infection has traveled up to your kidneys, which is a much more serious situation. Next up, let's talk about benign prostatic hyperplasia, or BPH. This is a very common part of aging for a lot of men, and it's not cancerous. As the prostate gland gets bigger, it can start to squeeze the urethra, which runs right through the middle of it, kind of like you're pinching a garden hose. And the symptoms are exactly what you'd expect from that pinched hose analogy. A weak or sputtering stream, trouble getting started in the first place, having to get up at night to go, and that nagging feeling that the job isn't quite done. Our third culprit is a totally different kind of problem, overactive bladder, or OAB. This isn't an infection, it's not a blockage,
It's a muscle issue. The main muscle of the bladder, which is supposed to chill out and relax while it fills, starts contracting all on its own, sending these false, high-priority, you gotta go now signals to your brain.
And the symptoms are a direct result of that twitchy muscle. The absolute hallmark of OAB is that sudden, intense urgency. And that, of course, leads to frequent trips to the bathroom day and night, and sometimes that urge is so powerful it can cause leakage before you can make it in time. All right, let's move on to Section 4, a lifetime of changes. This is so important because urinary health isn't just a single snapshot in time. The challenges and the things we need to look out for really evolve as we get older. Just take a quick look at this journey. In a little kid, a UTI might not even cause burning. It might just show up as a random fever or then being extra cranky. For teens and young adults, STIs can sometimes look a lot like UTIs. Women face a high risk of UTIs pretty much their whole lives. And for older adults, the symptoms of an infection can be really subtle, sometimes even showing up as sudden confusion. And all of this leads us to our final and maybe most practical section, prevention and red flags. Let's talk about what you can actually do to take charge of your urinary health, and, this is critical, when you need to get help immediately. Think of this as your simple cheat sheet for a happy bladder. The do's are pretty straightforward. Drink enough water, go when you need to go. And for women, peeing after sex is a great tip to help prevent UTIs. The don'ts are just as crucial. Avoid things that can irritate the bladder. And most importantly, never, ever ignore symptoms that keep coming back. Okay, now for what is probably the most important slide. Please, take a mental picture of these red flags. These are not wait-and-see symptoms. A fever combined with back pain, seeing blood in your urine, or being completely unable to go at all, these are signs that require immediate medical attention to make sure it's not something serious. So, let's end with this thought. Your urinary health is like a built-in dashboard for your overall well-being. It sends you pretty clear signals and often responds really well to simple, healthy habits. The real question is, when your body talks, are you listening?